It was the memory of his friends dying from preventable diseases that inspired South Sudanese refugee Samuel Dhol Ayuen to become a doctor. Today, he's helping save lives in Uganda's capital, Kampala, amid the global health crisis.
Most of my peers were claimed by measles. They died, and I was fortunate enough to have survived, despite the fact that there was no medical care at that time. So you were just at the mercy of the disease.
Ayuen fled civil war in South Sudan as a teenager in 2013. He and his family are among an estimated 1 million South Sudanese refugees who fled to Uganda. A total of 1.5 million refugees live in the country, making it the fourth largest refugee-hosting nation in the world, according to Wendy Kasuja, a spokesperson for the United Nations Refugee Agency. Uganda permits refugees free movement and access to public services, but Kasuja says many still face difficulties.
We have only about 20% of the refugees who are supposed to be in secondary school accessing it.
Ayuen was one of the lucky ones. After attending public high school, he won a scholarship to Makerere University in Kampala.
Considering where I've come from, my parents were really excited. They even had to commute all the way to come all the way from the refugee camp, despite the challenges, to come and witness my graduation. Because that was the first degree in the family. My mother has never been to school before.
Ayuen now works at the prestigious Mulago National Referral Hospital. Being a refugee, he says, is not a punishment.
It is an opportunity to continue with your dreams outside your country.
He says he wants to specialise in neurosurgery and return to South Sudan, where he can pass on his knowledge as a lecturer.